a little more in depth as to the different services that are out there. So I invited Carrie. I have known Carrie for many years. She has been kind of my go-to person in the assisted, independent, supportive living arena. She's been doing this a very long time. Sorry, but a long time.
Long time. That's okay.
So she kind of knows the ins and the outs of senior living communities. So I'm gonna let Carrie kind of step in.
Thank you so much, Christina. Hi, everybody. My name is Carrie Fenukin. I'm I grew up in Philadelphia. Went to school in Florida for hotel management. Moved to Atlanta, moved to Chicago. Met a guy from Payless Park, married the guy from Payless Park, had 4 kids with the guy from Payless Park, divorced the guy from Payless Park,
and got all the riches.
and here I am living in the southern suburbs of Chicago. So I've been here since 1988. The first part of my career was in the hospitality industry, and after a couple of after the birth of my 4th child, I switched careers after staying home for a couple of years, and I've worked, like Christina said, I've worked for the Sunrise organization. I've worked for a couple of supportive living communities. I've worked for some standalone memory care. I worked up at Peace Village in Payless Park. So I really do, just by default or the fact that I've had a lot of jobs, I do have a little bit of information, a little bit of knowledge about the variety of options for senior living here in the area. Right now, I walked to school today because I work right over at Charter Senior Living, which is across the street. And we are an all memory care community. Many years ago, it opened up as Autumn Leaves, 16 years ago, and Charter has been managing it for a couple of years now. So that's a little bit about me. I always get a laugh when I tell people, in fact, in the back, when I divorced the guy from the south side, and here I am. So, I wish I lived in Florida. I just got back from Florida, so you could probably tell that feeling. Yeah. So, okay. So what I want to share with you all today is just the variety of options that there are for senior living, and there are a whole bunch of options. The first option that I'm going to talk about is what they refer to as a life care community. That's Peace Village, that's Smith Village, that's Smith Crossing. Those are really the 3 that are in this marketplace. The idea behind those, they're either called a life care community or a CCRC, which stands for Continuing Care Retirement Community. When you move into one of those, you give them a down payment. You give them a couple $100,000. I can't tell you exactly what you give them. Each one is different based upon the size of apartment that you're taking and who the community is. I mean, there are some fancy schmancy ones that are in, Boca Raton, Florida, that you probably pay $1 million to get into. But the whole idea with them is you pay a fee, and then your monthly rental is a little bit lower than sometimes your other options. But the idea there is that they continue with your care throughout as you age. So if you could move into independent living, and then as you might need more assistance with your activities of daily living or ADLs, you move into assisted living. And then maybe if you have memory loss, maybe you move into their memory care. And then some of them also have skilled care, so you might move, through there. That couple $100,000 or $1 million, whatever, is refundable after you move out. Sometime, usually not 100%, usually 90%. But again, I don't work for any of those right now, so I don't know exactly what you get. But that's kind of the concept of those. And they're usually a pretty high-end product. They're usually fancy. They usually have beautiful dining rooms and bar areas and a lot of stuff going on. Sometimes they have pools, all that stuff. So that's one option.
What, when you move out, what does that mean? You mean,
well,
or pass
usually
away?
it means when you went to heaven.
Okay,
Yeah, yeah.
just
Just
clearing
a nice way
that
of
out,
putting it.
yeah.
So actually when you do something like that, you need to be pretty sure that that's what you want to do, because you've given them a lot of your money. It's a huge investment, and you've it's kind of almost like buying real estate. So then there's also rental senior living. Examples of that would be Hanover Place down the street, and that's really kind of the only one in this area.
Not Marine Courts. What's the one behind?
Tinley Courts.
Tinley Courts.
Yeah, and Tinley Courts. So Hanover Place is a little fancier. Tinley Courts is a little more budget friendly.
What about Heartland?
Hardest?
It's right on 159, the Hardest.
Hardest. That's
That's
assisted living.
That's what?
And I've worked there. That's assisted living. It looks fancy, like a hotel behind Home
Just got
Depot.
built, what, a year or 2 years ago?
Yeah,
Like
it's
5
it's a
years.
little. You have COVID, whatever that's called, like
COVID
warped
brain.
time,
Yeah.
warped time because of COVID. Because I think it's been there like 4 years.
Yeah.
Really?
But that's the way COVID works, right? Like we all lost 2 years.
There's something over there on Harlem. What is that one?
It's affordable apartments. It's Providence owns. Oh my gosh, what's the one? Harlem, yeah, 100 and in between 151st and
Right.
was it
Oh, Thomas Place.
Thomas Place.
Yeah, that's kind of like
Subsidized housing.
HUD living, sort of.
Yeah.
It's really hard to get into.
Oh,
Yeah,
They have a
really,
huge list.
So your rent is based off your income.
Yeah,
Oh.
that's rent-based income.
Yeah.
I don't know anybody that's ever gotten into Thomas Place.
I have not known anybody to get into Thomas Place either.
Yeah, I don't know anything about that product. Nothing.
I thought you were yes.
So anyway, so then there's rental senior living where, it's independent living where you don't get too many services. And again, like I said, that's like Hanover Place or this Tinley Court. You get a little apartment, and sometimes they have like a continental breakfast, sometimes they have transportation. It's a way to have an inexpensive, community-based, living. If you were to need care, typically people would call it bring in care, where they would go to a Bright Star or a home health company to bring in the care.
I will tell you, Hanover Place does have a nurse practitioner group that does come in to the facility. I only know that because it's a nurse practitioner who we work with closely.
Oh, okay.
So they do bring in services. I do also believe they have a gym there, like a little
Okay,
workout gym area. So home health can come in and do
Yeah.
home health and physical
Yeah,
therapy,
but they don't
so-
the community doesn't manage the care,
Exactly,
but you can
yeah.
bring in the care just like you would if you were getting home care at home.
Yeah.
What's
Does that make sense?
Brookdale.
Brookdale is assisted living, memory assisted living. Don't they have independent?
No.
No.
Not in some buildings.
Yeah. Or,
Oh, you know what, the other one that has independent living is the Sunrise in Olympia Fields.
yes.
That has independent rental. That's been a whole bunch of different companies. That actually was a Brookdale building for a minute. It's now a Sunrise building. I think it started as a senior lifestyle
There's
building.
a Brookfield, Ford.
Bigford, it's memory assisted living
Only?
only. So
Holy
it's
shit.
secured. You
Where's
know it's
that?
always been. Bigford's at 170,
170.
80th.
Yeah,
Mhm.
Oh, it was only? Because
Always.
when I went to my mother, it was like assisted living.
It's assisted living
It's
Yeah.
memory.
and memory. They have assisted living and
Do
memory,
they?
but it is
Yeah.
secure.
They're all very well memory patients in there.
Yeah, it's assisted living and memory care, but there's yeah. So, okay. So anyway, that kind of gives you an idea of those couple of things. Then there is, I'm going to jump over to assisted living because you all are interested in that, I can tell. So assisted living is for those people who cognitively could live on their own, but they need assistance with their activities of daily living. Okay, so activities of daily living. I'm going to give you some acronyms so that you're like, in the know. We refer to that as ADLs, and that's bathing, dressing, grooming, toileting, I hate that word, helping to get to the restroom.
Oh,
Or if you're wearing incontinent products, assisting with that.
Medications?
Feeding, medication management. So those are your activities of daily living. I mean, you just think about what you do for yourself. If you need assistance with any of those things, you're appropriate for assisted living. And assisted living is licensed by IDPH, the Illinois Department of Public Health, just like a nursing home is. So assisted living communities are beholden to the state. So they have state surveys, and there's people that are overlooking everybody that's in assisted living, and making sure that the assisted living communities are providing the appropriate level of care or the appropriate care. And they don't have folks in their assisted living that they shouldn't be taking care of. So people that they shouldn't be taking care of in an assisted living would be somebody that has a feeding tube, a breathing tube, somebody who is literally bedbound and cannot help themselves. And the last thing is deep wounds, like the kind of really deep wounds that you can get. Where in assisted living, they're not licensed to handle that. We don't have the nurses on staff to handle that in the assisted living. But assisted living is a great option for somebody that may have been living on their own. They are not driving anymore. You can drive still. There are people who live in assisted living who drive, but most of the time that can be a trigger for somebody that might do better in assisted living, because once they stop driving, they're cloistered in their own home. One of the best benefits of assisted living is the socialization. So you can stay home, and everybody wants to stay home. I mean, of course you do. Everybody wants to stay home. Go ahead.
You heard of Alvernia? Maybe?
Yes.
Okay.
Yep.
That's where my mother is.
Oh, your mother now or did?
Now, 104 and a half.
Oh,
Right here on
congratulations.
She
Alvernia Manor is this beautiful little senior living place up on the hill over in Lamont near where Unassisted Church used to be, or school used to be, and it's all run by the nuns. It's like a
Teresa's.
yeah. It's a very sweet place.
Yes.
Wonderful care. Pretty small. I don't know how many rooms they have. How many residents?
40.
40. It's really okay.
small.
Oh, that's not too. I mean,
Yeah, no, it's not.
memory care. Okay.
No, never really. When my mother first started, it was about 35 residents.
Okay.
It's never been to 40.
Yeah. Well, but they could do 40.
Well, they could.
Yeah. Okay. So anyway, that's another good example, and that reminds me, Franciscan up in Lamont is also one of those CCRCs. Although that's a rental, you don't buy in there. I don't think. I'm not sure. They have all kinds of levels, including Mother Teresa Home, which is the nursing care. So they have all that over there.
I've heard of a place in Alsip in Matson, and they just built one here in Orland. What is that one?
So are you referring to Alexi over in Matson off of 30 and Ridgeland? That's a new facility that just went up. That's assisted
That's assisted in memory.
in memory. And then you said Elsa?
You think it's all the same company?
What?
Do you think it's all the same company that
No,
manages those
Alexi
three?
only has that one.
Yeah,
I
Alexi
think it's
only
the
has
same.
I
one.
think he's referring to maybe
Warren Bar.
That's
No.
nursing care.
That's nursing.
Yeah.
That's Orland.
Yeah.
Orland. You referring to the Porter place off of Harlem and 183rd? 181st?
Yeah. I don't know. Maybe we can figure it out afterwards,
No.
or we'll get to it naturally.
Yeah, who knows? Yeah.
It'll pop into my head just
Well,
like.
the one that they're building now is where Schmedeke Funeral Home used to be.
Oh.
and it's for people who are blind, and also for elderly special
needs.
Oh, that sounds like a great
And that's
place.
the one in Elsa?
No,
I'd like to learn.
he's saying right here in Orland they're building Schmedike's, old Schmedike's.
Where's that at?
Union Avenue and about 142nd. just up north of 143rd.
By St. Michael's?
No,
What's up a hill?
Yeah, it's
if you come down Southwest Highway, it's almost like a U-turn. You go up that street
Yes.
near that funeral home.
I don't know where the old Schmidtke's was.
Well, I don't know anything about that place,
I'm
but
gonna,
it sounds
yeah,
good.
sure.
Sounds like a nice place. I'd like, and that's the way this business is that it's grown. Okay, so that's kind of assisted living, bathing, dressing, grooming, ambulating. Compared to living at home, you know, with a caregiver, and you probably had a home care. Oh, you were the home care.
Yeah. Okay.
Compared to living at home and managing a house and paying, depending upon what your financial situation is at home, you know, and how much it costs to manage the house, living in assisted living can be a more cost-effective option depending upon how much care you need. So bringing in one person, if you get to the point where you need care kind of round the clock, home care can get really pretty pricey, you know, over $10,000, $12,000, $13,000 a month, depending upon how much care you need. It can also be challenging in home care because you're staffing, you're worrying about whether they're going to come, you don't like them in your home. There's all kind. I mean, I'm not trying to bash home care, but there's all these great things about being in your home, and then there's some negative things about being in your home because you're having strangers come into your home, and then plus the expense of managing your home and paying your taxes and paying your electric bill and paying all those things that nickel and dime. So when you go into an assisted living, you're typically paying, depending upon the assisted living, you're typically paying a relatively flat fee with care levels put on. So sometimes those start like around 5,000 ish and can go up to maybe 9 for the highest level of care, and I'm pulling those out of my ear. I'm not quoting anybody in specific. I'm just going off the top of my head that, you know,
Sounds about right.
that sounds
Yeah.
low end, high end.
Yep. Unless you're going in the city where it's closer to like 12, high end.
Oh, where would it be 12?
Oh, on the north side.
Oh, okay. So down here, you know, where yeah. So,
Go to the country.
Go to country, it's cheaper.
right.
Yeah, it is cheaper.
So, and then the other thing that is a benefit of being in assisted living over being at home is that family and loved ones are not trying to coordinate care. You're not trying to coordinate, you know, all the things and who's coming in and who's schedule. And a lot of times at home, people kind of piecemeal it. They get a little bit from Catholic Charities, and they get a little bit from home care, and they get a little bit from the veterans or whatever. And they've got, you know, lady down the street who does the weekends, and then the daughter does the, you know, then the daughter does the overnights, and, you know, so that all sounds like a great idea until it's not a great idea anymore because it's just not sustainable. And that's a lot of time what happens.
Excuse me, may I back up a minute?
Yeah,
On the assisted living, did you say, I'm not sure I heard you right, between 5,000 and 9,000?
I did.
But it could be cheaper.
I did, yes.
A month, right?
A month.
Okay, I just wanted to add, I don't know if people know this, when you were talking about the first one, continuing care retirement communities.
Uh-huh.
Peace, I've been there several times and looking at it and talking to people. They do have, if people aren't aware of it, a plan, like where you did say that they will give you a portion back if you leave for some reason, other than dying. There are reasons you might want to leave other than dying. I had someone from our church that lived there, and his wife died, and then he left. I don't know why, but maybe he had a reason, I don't know. But anyway, they do return. They have a plan. You have 3 choices of what you get refunded. I know it was 70%, 90%, and I think one below 70% back. So depending on what you pay per month, you have a choice. You can choose what you want.
Okay.
And of course, if you're going to get more back, you're going to pay a little bit more per month for rent.
Yeah.
It's a very nice place. The people are extremely nice, very fancy, and be a lot less than $5,000 to $9,000.
Yes, because it's a continuing care.
Yeah, and you have a choice of different apartments that cost. So you have
That's a
floor
beautiful
plans.
place. Yeah, I worked there, so I do know that, but I didn't know that.
Yeah.
Go ahead.
What happens, because most of this is self-pay unless you have the insurance, what happens when you run out of money?
So I'm gonna get to that. That's called supportive living, and yeah. So that's the other thing is that all that I've talked about so far is all private pay, your own money, selling your home, using your annuities, using your social security check, whatever you've saved for all your life is what you're going to use your own funds, yeah. So that's pretty much the way that works.
At Peace, what they do is you use your own money, but if you run out, they have an endowment fund that they will help you pay part of it. And I asked them, well, how much? You're not going to pay all of it. How much would you help with? And I was told probably about 50%.
Okay.
Which
Which is still a chunk of change you have to come
yeah,
up with.
so
Yeah.
Yeah.
But they had apartments, over a little over $2,000 a month and
Yep.
so forth,
Yep.
depending on what you want and pick,
And that was at Peace?
Peace.
That's at Peace Village. Yeah.
So-
To visit if you're thinking, it was very nice. And everybody I talked to there loved it, so.
So if your money runs out, what if you go on Medicaid?
Right. That's okay. I'll go ahead and talk about
Yeah,
it
I
now.
was gonna say, I was like, you need to talk about it now.
There's first of all, I just want to say there's Medicaid and there's Medicare, and I apologize if I'm telling some of you things that you already know, but usually there's one person who really is confused about it. Medicare is your Social Security, is what happens when you get your medicines, it's what happens when you go to the doctor, it's what happens when you go to the hospital.
Or rehab.
Or rehab. That's all paid, and rehab. That's all paid for by Medicare, including hospice care. It's paid for by Medicare. Medicaid, but in all of these situations that we're talking about, Medicare doesn't pay for any of this. Like, people will walk into me and go, well, I have Medicare. And I'm like, well, that's really nice, but that does not pay your assisted living, independent living. What it would pay for if you lived in an assisted living is your medicines still, and it would pay for any physical therapy that you might get. And a lot of the communities, like including mine across the street, we have physical therapy in the building, and it pays for that. But it does not pay for your care, okay? Then there's Medicaid. Medicaid is the government paying when you don't have the money to pay or you've run out of money. So, and I'm not an expert in Medicaid, but I'm gonna give you kind of the high level thought about Medicaid. First of all, there's a look back period. So if you think, oh, I got this house, or I've got this Cadillac, or I've got a savings, but I want to use Medicaid because I want to give my kids my money. I want to give my kids my money. That's what everybody wants to do. I want my kids to have my money. They have a look back period of a couple of years. I want to say it's
So at this point, COVID has put a wrench in our system. It's actually 1 year.
Oh, it's only 1 year?
It's 1 year.
Huh?
Right now, because of COVID, because of the lack of employees not working, it is 1 year they're doing a look back. But also be mindful when you're applying for Medicaid and you're living in your home applying for Medicaid, you have different criteria to meet
Right.
than someone who is applying for Medicaid to go into a facility. So just know that there's two different criterias if you're looking to apply for Medicaid while still living in your home, while still trying to, make things work in your home. There's different criteria you're going to meet with that than a criteria you're going to meet when you're going into a facility.
Yeah.
So,
Thank you.
Yeah.
Yeah.
just
Okay, so the look back only being 1 year, I guess my thought would be start giving your stuff away now.
Yeah.
If they're not looking back. I thought they used to look back, I think
5
at
years.
least 5 years.
It used to be 5 years.
My mom was right.
So here's the way that I say it in Carrie Fenukin terms, because I don't have much of a filter. The government does not give money to people who have money.
No.
They just don't. I mean, I get that everybody wants to give it to their kids, but they're not going to give you money if you already have money. So, if you want to, and so I'm not a financial person, but again, if you've got a house, or if you've got a car, or if you've got an income from you were a teacher and you've got a pretty good income, they're not going to give you money to live in sort of living, and I've worked in that for a little bit. A donut hole, meaning you don't have enough to really live nicely in a nice place, but you don't have little enough to qualify for Medicaid. There I go. So they call that kind of the donut hole. So my suggestion on all of this, what I'm telling you right now, because I don't even balance my own checkbook, is find a financial planner. And I was thinking, I wish I had one to refer today this morning. And
I actually do know someone personally, happens to
Okay.
be a friend, I can get you his information. Just
Okay,
saying.
great. So if you've got, just somebody to give you that. So, but that being said, if you want to go to a place that has Medicaid, even if you go in there and you don't qualify yet because you have too much money, they're going to put you on what they call a spend down. So they're going to take your money, say you have a 401k and it's worth, $300,000. You're going to pay market rate at $300,000 until the money's gone.
Keyword, market rate. So you have to find a supportive living that has market rate apartments. Because not all
Right.
Not
okay.
all supportive livings have market rate apartments.
Yeah, I know. I don't want to give them too much stuff. So,
Just saying.
so
market rate.
yeah. So you have to be able to play. And when I said market rate, I wasn't going to talk about that. I was saying, the published regular rate. And yes, some of these buildings. So an idea of supportive living buildings would be Victory Centers. The Point of Kilpatrick, but they're very, very full. They're hard to get into, but they're the closest one here.
Right.
Anything that's Heritage Woods,
Marine Court and
and Moraine Court here in
what is that?
Tinley,
Brookdale?
Orland.
No. Marine Courts is
Oh,
in
Moraine Court, Bridgeview.
Bridgeview.
Oh, yeah, Uncle Dad.
So,
They're typically hard to get into though sometimes.
yeah, they're
COVID put a wrench in it. So prior to COVID, a lot of the supported livings were very full. There was usually waiting lists, all of that stuff. But because of COVID and people not wanting to move into that communal kind of setting because of the spread of COVID, obviously there's no availability.
yeah.
So,
Yeah.
but yeah, that's
So if you're gonna go though to hardest, whatever. You're gonna go to a regular assisted living. One of the questions you can ask is, what happens when I run out of money? Or a quicker question is, do you take Medicaid? They're going to quickly tell you no. Now this is really crazy Carrie advice.
Excuse me, what was the first one?
Victory Centers. So
Victory
there's one in Country
Centers.
Club Hills right behind Walmart. One in River Oaks, one in Park Forest. You're usually going to find them in the lower income areas.
And Heritage?
Heritage, yeah, like Heritage Woods. Kankakee.
Those are going to be Kankakee and then further
yeah.
west, Bolingbrook.
Yep.
Yeah, we don't have any in our area other than Point of Kilpatrick.
Yeah.
Housing.
Yeah. It's unfortunate. They go where there's going to be the highest number of people that need it.
And here's the problem: the state of Illinois only gave so many licenses out, and we're done.
Yeah.
There's no more building of these Medicaid supportive livings. Yeah.
Yeah, you have to get what they refer to as a certificate of need, and
They gave them all out.
yeah.
Yeah.
So I don't think that it's forever and ever, but for right now, there's none in the pipeline. All right.
What was your crazy thing you were just about to say?
Oh, so yeah, this is, just shoot me when Anyway, so there's people who really need to worry about running out of money, and there's people who just think they need to worry about running out of money. And I'm not an actuary, but advice is to do what makes sense for you or your loved one today and for the next couple of years, and worry about that later. You can always move to a supportive living later if you've got some money and you've got some income, and you may not ever even qualify for this. Because, the other thing I was going to say is to qualify for Medicaid, and maybe it's changed, so correct me if I'm wrong. You have to have $2,000 in the bank. I mean, you have to have no money to qualify for this, for supportive living. So, if you're never going to get to that point because you have good income or whatever the case is, so think long and hard about whether you want to be able to be sure that you have money for later, or whether you truly, absolutely need to worry, and you, honest to God, only have enough money for 9 months. Like, you get my point, right? Live for today.
Then make your children worry about it later.
Well, not, and I'm not even talking about giving the money to the children at this point.
No, I mean, just
at this point,
live for today, live for now, because you never,
yeah,
it all gets sorted out.
everything works out. Everything works out.
Well,
So
and here's
live
the
for
nice
today.
part. All of us that work in healthcare, who work in these different buildings, these different settings, we know the industry. So when you have families that approach you, like Carrie needed help with behavioral placement, so she called me and said, where do you know of? So we all have resources to help each other and help the families navigate this system, because we know how difficult it is to navigate the system. So we're always willing to try to help families. Right. So when you do have families that have run out of money, you go, hey, let's work on this.
Let's figure it out. And you just, I know there's that concept, and I believe in it. You don't want to move twice. And I get that you don't want to move twice, but you also want to live in a nice place. So that's all. I drilled that down. Okay. So then we were talking a little bit. Let's go through a few more that are there's assisted living and memory care in the same building. So Hardis is a good example, and I work there, and I love that building. It's a very well-run building. Hardis, Heartis. That's the one that's on 159th behind Home Depot and Andy's. Not Andy's. The ice cream.
The Fred's.
Freddy's. Freddy's. Yeah. So.
And then is. Yeah.
So if you go there, tell my friend Natalie that I sent you. That building just got 0 deficiencies for it's a great building. 0 deficiencies from the state. And the executive director just got promoted and recognized. It's a really good building.
Are they a continuing care?
It's just assisted living and memory care. Okay. So what happens there is you might move into assisted living, and if you then have cognitive impairment and need to go to memory care, it's right there. You also can move straight into their memory care. Okay.
But you would want assisted living if you're still capable of doing things on your own.
You don't typically want assisted living if you're capable of doing it. If you're cognitively aware and you're getting around fine and you're making your own meals and you don't need assisted living. You do look like you'd be the perfect person for Peace Village.
Yeah,
you should probably move now.
Yeah,
I would stop talking about it.
They've been calling me every month because I've been there so often.
And you know what? Here's the thing. I feel like a lot of these facilities are starting to open up with COVID restrictions, so a lot of them have move-in specials. See if there is
This is a good time to move in. Everybody wants you.
Yes, this is the
perfect. And I am a believer in move in now before something bad happens.
Yeah. Because you might not qualify if something bad happens.
Yeah.
Right.
Whereas if you're moved in,
and there's a lot of fun
things
to do, ladies to hang out with.
Yeah.
Spring is coming, which means there's going to be more outdoor things going on.
Yeah, stop thinking about it and doing it. It sounds like you like it. I call it ripping off the Band-Aid.
I just trying to get everything together to do it. It's a problem.
Yeah, do that later. I also have a theory about that. Move in and then sell your house later.
Probably the only way I ever do it.
And it's a
Yeah.
perfect time to sell a house too. The market's hot.
Yeah. So anyway, them, Clarendale and Mokina, Alexi and Matson, Brookdale on LaGrange Road, Sunrise up in Payless Park. There's a new one on Southwest Highway in Payless Heights called Payless Heights Senior Living. Those are all assisted living with a memory care attached. Okay? So that's like a mini continuum of care. You move in, and if you need memory care, and then if you go into memory cares are secure. They're for those people who have cognitive impairment and need reminders. May not remember, the days of the week, may not remember to feed, eat, may not remember to, may burn things on the stove, may wander out and friends find them having taken a walk, may drive and find themselves that they can't get home. Those are folks that typically need memory care. So then there's memory care standalone, and that's what Charter is. It's 42 apartments of just memory care. It's all on one level. Everything we do is memory care. It's not like you have assisted living, and then a lot of times in assisted living, they shouldn't do it, but we all do it, as they call, they say back there. Back there. Mm-hmm. That's where the memory care people are, back there. Behind the door.
You're right.
So, and it just is the way it is, and there's kind of a stigma for a loved one to move in to assisted living and know they're going behind the big door. It's, so your care in that is going to be fine. But there is something to be said for if you're at that point where your loved one needs memory care because of all those things I just said, there's some benefit in going to a place that all they do all day long is handle those with memory loss, behaviors, people who are up all night, and oftentimes when I'm meeting with families, I'm going to give you the rest of the list too, but oftentimes when I'm meeting with families, people tell me about all these things that they're absolutely so embarrassed by or think they're the only people that have ever had that issue, and everybody's got it. Oh, she gets mad, she won't go in the shower, she yells at me, she takes everything out on me, I'm saying she, a lot of times it's a mom, or she doesn't speak, she has aphasia, like all these things, or she's completely incontinent, and you know what I say to families like that? Oh, she's perfect, because that's what we do. That's what we do. So the other people who do what I do across the street are Porter Place, that's all memory care. Art and Quartz up in Payless Heights, that's kind of by all the
Manor
hospital care. And the, Manor Care and all that.
What does the Anthem have?
That's Porter Place.
Yeah, no, there's the Grace.
Oh, they have one in Oak Lawn called Grace Point Place. Yep. And then Bickford kind of feels like it's all memory care, but they do assisted living and they are secure. Bickford's the one in Tinley.
Right, because at first when we went 5
Yeah.
years ago,
It's
assisted
assisted.
into memory.
Yep.
Meaning they had a door.
Yep.
And that
They're
was-
assisted, but their front door is locked. Whereas most assisted livings, the front door is not locked.
They're all locked, because
Yeah.
of COVID.
Oh, well, even before COVID, they were locked.
Oh,
Yeah, they've always
Oh,
been.
They do not want their residents to go out the front door.
Right.
Right. Whereas in like a Hardis or a Sunrise or a
Yeah,
Brookdale,
You
Clarendale,
come and go.
you can come and go as you please.
Yeah.
Oh, there's also the Sunrise and Flossmoor.
I hear you.
Well, there's Sunrise Flossmoor and Sunrise Brookdale.
Right.
Like
There's
Old
Sunrise.
Brookdale.
You're right. There's a
Olympia
Sunrise
Fields.
in
Yeah, there's like
there's
across
a
the street from each
Sunrise in
other.
Flossmoor that's assisted living and memory care. I don't know how far all of you are from here or where people are. Does anybody have a building that they want to bring up or ask about?
George, I looked it up. You are correct. Sartoma Center.
Oh, Sartoma.
19 resident building, one in Elsip, one in Matson, one in Orland Park, and you could not be more spot on. 142nd and Union. Yeah,
Sertoma.
yeah.
Cool. Is it brand new?
The article was October 2020 that they were breaking ground in all of those spots.
Well,
Yeah.
So it's
yeah, it's got the whole COVID thing. Happened during COVID.
Yeah, so they the Elsip base Sartoma broke ground Thursday morning on a $7 million supportive living housing unit at 14205 South Union Street. So
It's for
the building was
educate
19 people.
visual and
And that was, again, the article was from October 29th, 2020. Obviously, I'm sure COVID threw a wrench in a bunch of stuff, but it was supposed to be completed the fall of 2021. So I would start looking into that.
Well, that building on Union is about 4 or 5 stories. How can they only say 19?
Well, because they might have different levels in the sense of like the first floor might not have any apartments at all. It might be your dining room, your activity room, maybe a workout room. So
right.
you gotta look at it that way.
And they're new.
What?
What's that for?
That's for disabilities.
But
People with disabilities. Yeah.
So there's one other, I'm glad I wrote notes. There's one other thing that I didn't really talk about, and that's nursing homes. So there's 2 different kind of ideas for nursing homes. So if there's skilled nursing rehab, and then there's living in a nursing home as a resident.
So we actually have some next week.
Oh, you're gonna learn
We're
about
gonna,
that
we're
next
gonna learn
week.
about it next week.
Okay.
Yeah, about rehab in general and
Okay.
like what that looks like with
Okay,
yeah, and then actual like long term.
okay, perfect, so I don't even talk
You
about
don't
that.
even have to talk about
So
it. You're good.
that's a whole different
Oh,
topic.
that's a
Well,
whole
I'm
different
glad that
beast.
well, and the reason I wanted to bring that up is long-term residential skilled nursing can either be paid for by Medicaid or it can be private pay. So it's one of the, so if you go into those places, those places that I refer to as like the Victory Centers and the Heritage and the Point of Kilpatrick that are the supportive living Medicaid places, they only go up to a certain place. And most of them don't even do memory care. Point of Kilpatrick does. But once you get, and they're managed by Health and Family Services, whereas assisted living is IDPH. Those supportive living buildings are HFS. Completely different bucket, completely different arm of the government, completely different thing. So they're Health and Family Services, I guess, because they're trying to help people,
Medicaid.
financially, that kind of thing. But anyway, so they're a whole different thing. But they only care for folks. They don't have a long. They don't go far in the care level. If you get beyond their scope and you're on Medicaid, they're gonna send you to a nursing home.
There are some locations like the Victory Centers really do believe in aging in place. So there are some Victory Centers, depending on who the ED is, things like that, who will let.
Yeah, right.
I got some contacts.
Yeah.
But there are some that will let you. Again, it all depends on whoever the ED is. But I know the VP of Operations now, so
Yeah,
we're gonna go past that.
yeah.
But they will let you age in place. I mean, they're really. I don't think Prairie Green lets you really do that.
Yeah.
Um,
Yeah, there's 2 others, Prairie Green and Blue Island, and one in Chicago Heights.
But yeah, they're not historically
One is
known.
called Prairie Green at Phase Point, and one is called Prairie Green at
Dixie Cross.
Dixie Crossing. I work for that company, and I'm looking at you for the names.
But yeah, no, Victory Center usually is pretty good with letting you
Okay.
age in place. Obviously, if you're like a brand new person that's moving in and then you're going straight to hospice, then they're usually pretty quick to get you out. But if you're someone that's lived there for years, they'll
Yeah.
let you age in place.
Yeah.
I had a 90-something-year-old that was completely bedbound with wounds when I worked at Victory Center, and she was like fed
And they kept
every meal, and they kept her because she had been there. She literally walked in the doors and
Yeah.
aged in place.
Yeah. So
So,
they probably, and that's the other thing I call that like a threshold for whatever is, I forgot to mention Evergreen is a very popular, Evergreen Senior Living over by the church, Parkview Church. Very popular building. They have a reputation for being what I refer to as assisted living light. They even call themselves that.
yeah,
They like you to be pretty high functioning at Evergreen. They will, they don't necessarily, like a lot of these buildings, like where I work now, Charter or Hardis, they have a, age in place until you go to heaven theory, no matter what's going on. Evergreen does not. They want high functioning, high ambulatory folks there, which is great for those who are high functioning and ambulatory. And no, everybody doesn't. Literally everybody thinks they're not as old as the people that are in there, and they see walkers and wheelchairs, and they're like, "There's walkers and wheelchairs." I'm like, this could be you in 6 weeks. Everybody is going to age. It's inevitable. So, so they attract people because it looks all vibrant and wonderful, but they don't. That's not their shtick. Their MO.
Yeah.
And then Payless Senior Living is the same way.
There's one in Mokina.
What is that place
Claria.
in Tinley? It's Bremen something.
Oh, that's the Bremen.
Isn't that
It's right
Tinley
off
Court?
Oak Park
Tinley
Avenue.
Courts. It's Tinley Courts. Oh,
No, it's called, it's independent living.
What you said it's off where?
It's right off Oak Park Avenue. It's before, if you were heading north,
Across
south,
away from the dollar store.
it's down from it, but it's actually at Oak Park Avenue,
Oak
where
Park.
you would, Oak Park, where you would turn on Central. It's Bremen something.
I don't know about that place.
Oh, the senior center. That's
No,
the
it
Bremen
might just be the
Township
senior
Yeah,
center.
that's just the Bremen Township Senior Center.
Yeah.
Well, they have living there, living space. They have apartments there. I don't know what,
You
I
said
don't know.
before you turn on the Central.
no. Oak Park Avenue and Centennial Drive in Tinley.
Oh,
Right
those-
at the
those
corner.
places right on the
Yeah,
corner there?
what is that? Yeah,
Yeah, I don't know.
it's Bremen something. I don't know, I just seen the sign.
Oh.
Google it.
Um,
Google everything. Don't laugh at me back there, Sandy.
that's independent.
What?
Is it
What?
independent or is it?
Oh, Brementown Manor.
Yeah,
Brementown Manor, what is that?
It's a retirement home. Hold on. Well, it's independent.
oh, independent, okay.
They're apartments.
Yeah.
Literally apartments.
Okay.
So they're not gonna have your.
No.
It's an independent facility located at 16130 South Oak Park Avenue.
Yeah, so it's independent.
Independent, yeah.
Apartments, okay.
Just apartments, huh?
So they're just apartments, pretty much.
That are for $55.
Yes, they're old.
I didn't know what it was.
$55.
was this supposed to be an hour?
Yeah.
My
You're good.
gosh, I thought I had about 10 minutes worth of conversation.
Mm.
No, I told you.
I know, this has
Everyone
been
just
great.
kind of talks.
Questions? We've got 5 minutes.
Well, yeah. What you guys want to learn more about?
Where do I sign up?
Yeah. I know you go into some of these buildings and they're just beautiful.
Oh,
You know.
Smith Crossings.
I've read
Oh,
Smith
that's
Crossing.
buy-in.
If you can afford it.
Yeah, that's buy-in. But that's your CCRC. That's your continuum of care. That is I always say it's the elite of the elite.
There.
Yeah.
I did rehab there for.
And you are lucky because
Yeah,
they
it's
only
hard
have
to get in
like
there.
15 beds for rehab, and they save a lot for their own.
It was very nice.
Smith Crossing. I was gonna get
That was
some of
my
my clients
Smith
there.
Crossing.
My
Yeah.
first rehab wasn't so good.
It's a little cheaper in Florida though.
Is it?
Yeah. Well, yeah. it depends.
Well,
Unless
look
you're-
at me.
So
Man.
many seniors that they
Yeah.
really have facilities.
I mean,
I know they have them all
realistically,
over.
I had a staff.
and laugh at me, Sandy, but Google is your best friend because Google's going to tell you a lot with reviews. I mean, realistically, I would say make a phone call first, and when you start looking, every community kind of makes, there's so much, in regards to like what they can take, what they can't take. Make a phone call first. Don't drive there
Take
just
a
yet.
a flight over to Florida. I had a staff because my brother took me around because we're thinking about moving with my mother. And like, there was tons of facilities just in one little town.
100%.
Yeah,
That's why I always say where I'm gonna move to. The railroad needs to go down there so I can move down to Florida, because my job is golden down there.
Yeah, seriously.
Job is golden. Healthcare is it's so
Definitely.
saturated.
Well
But
there.
But it's all, it's always good to just make a phone call, make sure it's even gonna be what you're looking for, cause
Sun,
like,
fun.
like Carrie said, I mean, you have some facilities that won't even touch what other facilities will,
Yeah,
so.
even though we're all licensed the same, or many of us are licensed the same, they just, it's nothing wrong with it, it's just what they've decided how they wanna operate their
How they want their
business.
business to look.
So, and then there's definitely, kind of what you're talking about, when you go in, you'll know immediately, there's a vibe, you're just gonna know whether it feels right for you or for your loved one.
I can tell as a contracting service going into these buildings if I'm gonna like the people I work with. Like, you can just tell by the way you walk in and you see the residents and what they're doing, and you just know when you walk in places if it's gonna be a good fit.
Yeah.
Was it a good fit at Peace Village?
She's gonna sign up next week, I'm calling.
Hey, I started about 25 years ago looking.
Oh, jeez.
Yeah, you need to do it,
My
yeah.
husband died early and I knew I'd have a problem eventually, so.
Yeah, you'll have so many friends if you move over there, and it's just so fun.
But you know what I did learn, because I've done a lot of research on this, is that, like you said, you can go on the internet, and I didn't know this, my daughter, or stepdaughter told me that, when you look up these places, you could pick 3 places and do a comparison of everything, and they'll give you the ratio, the help, and the, price, and, all kinds of information,
Oh,
Yeah.
is it through IDPH?
That's how I picked Smith Crossing for my second rehab. 'Cause
Oh,
my first one
well,
was
so,
terrible,
but
and I wouldn't go back there.
Assisted living's different. There really is no skilled
it's
nursing,
Medicare.
you're talking at cms.gov, yes, you can compare nursing homes.
Yeah, I don't know exactly what, just put in health and,
But they-
caregivers or
Yeah.
rehab, I think.
Rehab,
something like
yeah,
that.
so that's through cms.gov, that you can do a star rating compare. So there's different categories that IDPH judges a rehab, a
That's what
nursing
it was.
home.
Yeah, they had
Yep.
stars for all the different
Yep.
categories.
So it's nursing home compare. So it's cms.gov nursing home compare, and you can compare 3 different facilities and the different star ratings and categories.
Somehow we
One
got
is like
there.
nursing and staffing, one is health inspection, one is quality
Yeah, so they
metrics,
had all that stuff.
and then there's the overall star. I think there's one more, and then there's the overall star rating.
That was very helpful.
It
Because
is.
you didn't have to drive around and do
It is.
all that.
But can I tell you something? I've been in facilities that are 5-star facilities, and they're not 5-star facilities. I've been in facilities that are 1-star facilities that actually have really good
How does that
staff.
happen if they're rated by the?
Because realistic, we can talk like next week. She should be talking about this, because realistically, you might have when you have facilities that are so like. Your star rating, one of the categories is like staffing, right? So you have to facilities have to submit their daily staffing every day to CMS. You have one bad apple of an employee who doesn't submit the numbers for a week, guess what? Your star rating just plummeted.
Yeah.
So it could be a clerical error. It could be like, I don't want to always say, it could be you could get a bad.
So if you check more than once, you would get an idea.
I always tell people, if you're gonna look at like a nursing home, not only should you obviously go in, but you should try to, if you're on a tour and you see a family sitting there, ask them how their experience is, because there's no better, like, your residents, your patients, like those are your people who are gonna give you that feedback. So like, even if you're looking at assisted livings and things like that, if you have families and residents that are there, ask them, how is it here? How's the food?
Right.
What are the activities like? What do they do for outings? Like, those are your best, like, that's where you get your reviews from, is when you're in those facilities. Talk to the residents,
And I
talk
guess
to the
in any
families.
place you go, there's some good people, some bad, you know.
And that's exactly it.
Well, yeah. Do you like all your neighbors now?
Yeah,
No.
right.
So, right.
No.
I don't even know.
And I couldn't even pick them, that was the problem. You know, at least you can pick your facility that you're gonna be going to. So it's always good. Talk to the families, talk to the residents, talk to the employees. You know, if there's employees that like their job and they like who they work with and they, you know, like, I'd be sold in a heartbeat. You know, this industry's hard. So.
All right. Thank you so much.
Carrie, we thank you very much. And
Thank you.
Yeah.
What did you say?
Nice to have you as a neighbor.
Oh, yeah. Is there anybody here who's like, while you guys were taking notes, that's actively looking? I think you guys are actively looking.
I'm a caregiver, so
You're a
I never know, and
Yeah.
I just like coming because I have the information.
And then you know. Okay.
Yeah. Well, so I'll give you one of her
I
cards.
don't, I'm not looking, I'm not trying to make a deal right now. I just was curious.
I would.
It's kind of cool to get the information. Like, this is the kind of stuff that you don't know that you don't know.
She would like a couple.
Oh, send them. Pass them on, maybe. So, all
I
right,
always say two. I can give you.
all right. Well, this was fun. Thank you for letting me into your home.
Very informative.